In the BigMedilytics project, the Erasmus University studied the uptake of big data innovations in healthcare. Big data innovations promise to revolutionize the way healthcare is delivered. And these innovations seek to address the rising demand for high-quality healthcare services and are expected to improve population health and to reduce the cost of care. Big data projects, like the BigMedilytics project, wish to demonstrate that big data can actually achieve these results. And we want to measure the impact. And I'm going to outline now what is important for measuring impact. Measuring the impact of big data innovations is equivalent to identifying and quantifying the causal effect. We want to be able to quantify by how much the quality of care would be different if a big data innovation had been present compared to the situation if it had not been present. This requires a clear understanding of the cause and effect mechanisms. Without that understanding, we can still measure various indicators for monitoring or learning purposes, but we cannot attribute a causal meaning to these measurements. So the central claim is that deploying big data innovations does not improve the healthcare directly, but that these innovations can help to contribute by changing the information upon which decisions are made. And this translates into a sequence of cause and effect relations, which I'm going to outline now in a causal model. We are facing a dynamic environment in which data is generated continuously. Mobile apps record our physical activities, smart devices keep track of our lifestyle, and e-health technology increasingly monitors clinical signs. This continuous data generating process is coupled with a growing belief that combining and analyzing the data can actually improve decision making. For instance, data-driven prediction models can inform about potential deterioration of the patient's condition. And these prediction models are expected to help clinicians to decide whether and when to intervene. With an ever-increasing amount of data and technology, data scientists and healthcare practitioners generate new ideas about how data and technology can help to improve decision-making. For instance, one of the BigMedilytics teams was wondering whether the integration of real-time weather data can improve the accuracy of their prediction models. Data scientists and healthcare practitioners jointly explore how these ideas can be developed further and implemented in routine care. In order to transform the data into information, mechanisms and algorithms are in place to extract and pool relevant data. Inherent here is the idea that adequate mechanisms and algorithms are deployed that extract the right data at the right place and the right point in time. This requires efforts and a lot of invisible work, such as cleaning and correctly annotating the data. Importantly, the data transformation phase is not free of errors, since integrating data can introduce bias if the data is incomplete or inaccurate. Think, for instance, sometimes fake data is generated for practicing or demonstration purposes, and this data needs to be filtered out during the analytics phase. And these efforts can reinforce or mitigate the belief in big data technologies. After the transformation phase, information is presented to the decision makers in a customized fashion, frequently also supported through visualization tools. Inherent here is the idea that the right information is presented to the right person at the right point in time and in the right format. This is where things can go wrong too. It might require effort to obtain the information because it's not automatically integrated in the workflow. Too much detail can also lead to information overload. And mismatches between the information context and the decision maker's information literacy can occur. And decision makers may fail to adequately understand what is presented. And this affects how information is interpreted and what meaning is attributed to the different options under consideration. This could cause frustration and dissatisfaction. Data and information can be perceived as less useful, which can negatively affect the belief in how far big data and data analytics can actually improve decision-making. The way information is interpreted also affects the decision-making process and which decisions are taken. Prediction models, for instance, have fuzzy decision points. Patients are more or less likely to respond to chemotherapy, and there are patients for which this is not a clear-cut decision. How certain can you be? Different clinicians and different patients might respond differently to the uncertainty in the information, which might cause different decisions about the patient's health trajectory. It can also happen that health processes do not go as intended. The patient's situation can deteriorate unexpectedly during treatment, and ad hoc adjustments are necessary. Or we can think of other exogenous shocks, like the COVID pandemic. This caused lots of rearrangements in health services processes. For instance, in-house consults had to be postponed or replaced by remote consultations, which affects cost of service delivery. The question is this change in cost attributable to big data technologies or rather a consequence of the COVID pandemic? The way the health trajectory evolves also affects in how far we can achieve satisfactory short-term outcomes, such as a reduction in hospitalizations. It also affects the data that is gathered at this stage. And it affects whether new demand for healthcare is generated, if patients are readmitted to the hospital, for instance. Therefore, whether satisfactory long-term outcomes are achieved and what type of new healthcare demand and data is generated is dependent on a sequence of decisions and a sequence of exogenous factors. Mortality, for instance, is not only affected by how well an algorithm supports clinical decision-making, but also by the patient's underlying health condition. And how far changes in long-term outcomes can then causally be attributed to big data innovations is therefore dependent on how rigorously we can establish the counterfactual scenario of what had happened if the big data innovations had not been developed and implemented.